everyone, Jeremy here, and welcome back to the Command Your Brand Show. Once again, if you guys are new to the show and new to this channel, you're going to want to hit the subscribe button below, share us with your family and friends, leave a comment, leave a like, and help us to make a bigger impact out there. So today is something I'm very interested in talking about as a parent. Our guest today is Dr. Blaine Leeds, and he is a general dentist with more than 28 years of experience, and he's looking at issues that our children have related to their mouths that you wouldn't think of. And we're looking at things like bedwetting. We're looking at sleep issues. We're looking at different things that are happening. And a lot of that actually comes from what's happening with their teeth and what's happening with their jaw. So I'm really interested to dive into this. So Dr. Leeds, thanks for hanging out with me today, sir.
It is my pleasure, Jeremy. Thanks for having me on.
So I'm curious to find out first and foremost, because you've looked at jaw formation and things in a very different way than a lot of other dentists. Like, how did you discover this? Like, how did this, kind of come across your desk?
Well, it's kind of like the Hair Club for Men commercial, when the doctor used to say, "I'm not only am I a member of the club, I'm not only a doctor, I'm a member." So in 20,
that reminds me of the members only jacket commercials too. But anyway,
there were no button flaps on my blazer today, and no zipper either, or zipper pocket with the very signature 80s. For those of you under 30, a members only jacket, Google it. It's a thing. There are probably parachute pants involved too. You can look those up. And talking heads and other things from the 80s that'll be worth your while. But in 2011 or 2012, my wife, who could sleep through an F5 tornado, I'm a Southern boy from the Tornado Alley here in Arkansas, so that means something around here. I don't know. Is the Fuji something scale, that measures the pressure and power of tornadoes?
Yeah, that's over my head. I don't really know. That's like millibars and all that kind of stuff. That's over my head.
Yeah, but anyway, so but she could sleep through one of those. Very heavy sleeper. I like to call her a professional sleeper. In fact, she can sleep. She's asleep now, probably somewhere. My wife.
My wife says the same thing about me. Whenever the kids are up, I go into a sleep coma. Whenever the kids are up, she's up.
Yeah, that's it. And I was that guy in the mornings. And of course, when they became rock and rollers and stayed up late, she took care of that problem. So that was good. But 2011, 2012, she noticed that I was struggling to breathe or stopping breathing in my own sleep. And so I became a sleep apnea patient and found out that I had been struggling with it for a long time and had no idea that in my profession as a dentist, we had such limited education about it. And so I was, at that time I was 16, 17 years into my career and was not talking to my patients about sleep at all in my practice. And so I immediately was like, I got to get this fixed and so I went the standard route, went to my doctor, had an in-hospital sleep study, and was prescribed a CPAP machine with a nasal pillow. You want a nasal pillow, folks, if you're going to have a CPAP machine. And I put mine on the first night. I slept 4.5 hours. It felt like I'd been asleep for a month.
Wow.
It was like I'd been given some magic drug or something. So there's no telling how long I was without restorative sleep in my life. I was a very busy person. I'd always been a very light sleeper. Those are two things, and I never really, that many times people have issues with sleep. Light sleeping is sometimes can be a clue that you might be an apnea patient. So
my 2-year-old is actually that way. My 4-year-old could sleep through an atomic bomb. My 2-year-old sleeps in clips. And we often, like, my wife and I have this joke about her nap time. Like, if somebody drops a pin, it's over. Like, you know what I mean? Like, my 2-year-old actually does not sleep well. It's terrible.
Yeah. Or and I rarely had dreams, which is another, we know that we only dream during REM sleep typically. Mm-hmm. So, and you should get at least 2 REM cycles per night as a human being. And you should be sleeping and breathing comfortably through your nose, but I was not. And so I was mouth breathing. I had gained a little bit of weight, but I was fairly athletic. So, but basically my schedule was about midnight. I'd get up to a little bit before 5 a.m. every day. I never required much sleep. I was always on the go, always moving. And so really didn't have time to figure out if I was a bad sleeper or not. I was a busy dad and a busy dental practitioner and had other things going on too. And so I needed to, I didn't have time to sleep. It was like that line from Roadhouse with Sam Elliott, where he says, I'll get all the sleep I need when I'm dead, and that was kind of my motto. I was like, oh, sleep is really important. But then and also another key sign of patients who may have undiagnosed sleep apnea is an unexpected spike in blood pressure. I had always had low to normal blood pressure, and I started seeing my lower number, the blood pressure, the diastolic number creeping up in the mid 80s to close to 90, which was very unusual for me. My blood pressure was always 118 over 68. I was pretty active, and so never had issues with it. My mom's whole family always had a low blood pressure readings and could eat all the salt we wanted, that kind of thing. So when I found out that I had a problem, and once you're a patient yourself, I mean, in dentistry, they say the average dentist sees their patients 15 to 20 minutes per year because patients come in for hygiene in the dental world. In the medical world, the average physician sees their patient about 7 minutes every 7 years. If you're healthy. And so in dentistry, we notice a lot more physical or health related changes with our patients. And so I just started to, and there are lots of oral signs and manifestations of sleep problems, including grinding your teeth or patients having difficulty breathing if you lean them too far back in the chair, if they're mouth breathing. Human beings are obligate nasal breathers. We should be breathing through our nose quietly and visibly, comfortably all the time. And if we're not, then that's an issue. And also snoring or sleep obstructed breathing has been, there's a Friends episode. I can't remember which character snores. I think it may be Ross or Chandler, but they make fun of it, or Joey. And of course, they have all the way back to the Seven Dwarves, the sleeping and the snoring. And some mild snoring, if it's nasal related, is okay. But usually snoring is a serious thing. It's a sign that a patient is not breathing. And if you have a patient that's breathing through their mouth at night, that's not good. And so that's how it started for me. How did I get interested in it? Well, I was like, oh my gosh, I've only been treating, a few teeth at a time on these patients. I need to start treating the whole patient. So we started taking blood pressure on my patients at all the hygiene visits, which all you dentists and hygienists out there, that's a really nice service for your patients, because we just quantified that they're not seeing their doctor very often.
Right.
So many patients probably haven't had their blood pressure taken in 4 years. And that's the first thing that they do. If you go to the ER, if you go to the doctor, they're going to take your vital signs and see what your baseline is, And so at the dental office, we should all be taking blood pressure readings, because it can be an indicator of something more serious going on. There's so many oral health clues, oral problematic clues, that where we can help patients. And I found out I started saving patients' lives from the dental office, because most heart attacks occur when, Jeremy, there's your trivia question. When do most heart attacks occur?
When watching the NFL on Sundays.
If you're a Jets fan, yes. Then
the officials aren't even on your side.
That's an excellent guess. But most and it was a big obtuse sort of question, but most heart attacks occur at night.
Wow.
And so, what happens is, we know that now for 20 years of studying it, that there's a very characteristic sort of a cardiac trampolining effect that happens, because when we have obstructed breathing, we eventually stop. And now we can track patients with an in-hospital sleep study, or with a sleep ring from a company like Sleep Image or Whisper, where you just wear a little ring on your finger at home, tie it into an app on your phone, and you get a very, very detailed sleep study where we can see exactly what your oxygen saturation is, what your cardiac response is while you're attempting to get restful sleep. And they estimate, I think, I'm not sure which group did the study, but 64 million Americans may have undiagnosed sleep issues of some kind.
Wow.
Very common. It's also more common in folks like me who need to lose weight. And so, thank you, Kentucky and Mississippi. I think Arkansas is now only the third fattest state in the union. So,
let me ask you this then. So you discovered it as your own problem. You started trying to solve this. Started looking at patients more. How did that lead you to looking at what's happening with kids? Because the connection I thought was really interesting is you connected it to things like, bedwetting and things like that, which I had no idea that those things could connect. I had, and you and I were talking about this before we started recording, I had heard that like some kids can get like a malformation in their jaw if they're not breastfed, because they're actually not working those muscles. But how did this get you looking at this?
Well, when I started looking for, because basically with CPAP, we're helping a patient breathe, so we're treating the symptom of the problem. And my problem is my jaws are too narrow. I have a unilateral crossbite, which means my upper molars are inside my lower molars on one side of my mouth. I have what's called a palatal torus, which is a bunching up of bone in the palate. They're very common. About 30% of patients have them either on the palate or inside their lower jaw. They look like Tylenols underneath your gums, little bumps of bone. Well, what happens is when we're during our growth phase, when we're depositing bone into the upper and lower jaws, when the teeth, because the teeth have peaks and valleys on them, right? So they're locked together. So when a patient is closed together, if their jaws aren't the right width or they're not expanded properly, then the body's going to, these osteoblastic cells that are building bone are going to deposit the bone somewhere. So that's a hint or a sign if you're a dentist and you look, or a hygienist or a dental assistant, and you look at a patient or a parent, and you look at a patient, they've got a strange bump on their palate or on, below their tongue. This could be a sign that they're having trouble sleeping.
Wow.
But so once I figured out, okay, I'm taking care of the symptoms. Now let's fix the root problem. Let's look at expanding my teeth and my the jawbone. And am I going to have to do that surgically, or how is that going to work? Because I was taught and trained in dental school that I was going to have a surgically assisted rapid palatal expander. You may have had a friend or somebody that had braces as a kid, and they had a little jack screw in their palate, and they had a little key at night that they have to turn. And
that sounds really invasive. Wow.
It does, but it's not, because it's
okay.
On a child. If we have bands, imagine, this will be not to get too geekoid here with you, but if you have bands on the molar teeth, there are appliances that it's basically for a compliance issue, so that a child can't take it in and out of their mouth. It's cemented in place.
Okay.
Like bands would be with bands and brackets on and wires if somebody's having traditional braces. But it's a very slight turn. It's like a quarter turn of this key every day. But it's before the patient is 16 or 17 years old, so when their growth plates fuse. So there is a suture, that runs right down the middle of our palate. And that suture is still soft until a patient's growth plates fuse. So it gives us the idea that you can expand the palate, and when you widen the palate, then you've got room for all the teeth to come in, because you're fixing the foundation. You're giving the patient plenty of room in their jaw. So I was looking into that for myself. How am I going to get this expansion done? And then there are some companies out there that have actually had some good fortune expanding adults with appliances without surgery. And so I began to explore some of those opportunities. And then I found out how radically different we can help children, because we know we can expand a child because they're still growing and developing. And that's where we can have the most effectiveness, is helping kids with an appliance, or maybe even a fixed appliance, or some early orthodontics, which we're learning now. We can make clear aligners for kids now, even in the mixed dentition phase, the latter part of it, and have some success. We've got some colleagues that are working on things like that. So I became really particularly interested in the children's treatment, because we know for sure we can get good expansion with a child, whether it's with a removable appliance or a fixed appliance or some sort of an orthodontic treatment.
So looking at that, other issues that have come off of this, such as bedwetting and stuff like this, how did those things happen? I'm really curious, how a mouth issue could trigger those things. It's so interesting to me though too, because you look at so many even diseases we experience and things like that. So much of it starts in the mouth, it's very interesting. But I guess looking at these different issues we see with kids, how does that happen that a dental issue causes these other things?
Yeah, well, it's basically a function of poor sleep. And the poor sleep happens because there's obstructed breathing. And so if we zero in specifically on bedwetting, when a child in the middle of sleep, if they're trying to breathe, their body goes into fight or flight mode. And so the brain will tell the heart, okay, we got to pump more blood because this person's not breathing. And so the heart rate goes up. And then many times when a child finally gets into a relaxing state of sleep, their kidneys and bladder relaxes. And so so that's where the bedwetting comes from. It's really a protection mechanism, because the body is saying, okay, we've got to do something, to wake this human being up, because they're not getting oxygen to their brain.
So looking at that, then I guess going back to the problem itself is, you're putting some sort of an appliance in there to help kind of change the condition. I guess what does that look like, and what does kind of that process look like? Like how long does that take? Like is it something that's like graduated? Because like I look at like I did Invisalign for myself for my teeth. I had terrible teeth for years, and like every 2 weeks you're changing out a liner or something like that. So like how does that work in terms of like handling this palate issue?
Sure. Well, it depends on the age of the child. The younger the child is when we diagnose them, the better. And
Hmm.
which is in the profession of dentistry, many times dentists are taught, well, let's just wait till they're 10 or 12 years old and got all their permanent teeth in, and we'll do orthodontics. So, because they're going to be losing some of these baby teeth. So, but we found out that, the whole time that if a child has deficient width in their jaws, underdeveloped jaws, they could be struggling to breathe. And so,
So it's
what these
creating a lifelong issue because you're not handling the actual problem.
well, or you might be handling it when they're 10 to 12 years old. And then we got to make sure and then is it even possible with standard braces or Invisalign to expand somebody as much as we need to? And so what
Mm.
these appliances do is it's a simple appliance and there's several companies that make them. But the appliance it's just put in the child. If you hand a 2-year-old the appliance, I mean, what's the first thing that happens, Jeremy, if you hand your 2-year-old something? What do they do?
Uh, Put it in their mouth or their nose. We went to the emergency room recently because she shoved a rock up her nose,
Yeah, yeah,
and I couldn't get it out.
the black-eyed pea and the English pea fit nicely in the nose and the ear too. So, but yeah, that's right. They put it in their mouth, so it's almost intuitive. We hand a child a simple appliance, and as long as they can wear that appliance, they wear them for 6 to 9 months at a time, and we can graduate them up in these very simple removable appliances. And sometimes we get in, we get out. We start early with a child, and we get in there with treatment. They respond pretty well. But if I give this appliance to 10 children, 10 7-year-olds who are bedwetting, 6 or 7 of them stop bedwetting that night. It's that
Wow,
much of an impact.
that's really interesting.
Yeah. And so breathing through their nose is so important. And once the jaws are constricted, if our jaws are too narrow, it makes our palate do what? It makes our palate arched. And the palate is the floor of the airway space, which is where all the nasal breathing should occur. And so the whole issue is underdeveloped jaws. And that's what I'm on a mission to do, is just help tell that story. And I work with a bunch of brilliant colleagues like Dr. Ben Moralia, who is like the godfather of this treatment. He's been doing it for 20 years in Mount Kisco, New York. He's had patients that were on 8 times the adult dose of Ritalin when he saw them at age 8 years old. And I mean, it's
Oh, that's really interesting. So you're seeing like things like ADD come off of that as well, like
that's right.
ADD
Yes,
and ADHD. So just kids not having restful sleep, so they're behaving odd.
correct. And they're not
Wow.
sleeping. And so, and when you tell a mom or dad, well, your child's not sleeping well, they go, well, I can't wake them up in the morning. And they're sleeping great. And no, they probably just went to sleep at 5 a.m. And so it's many kids that have anxiety or ADD or attention deficit type issues. It can be related to underdeveloped jaws.
Wow. And then instead we have people just trying to give them speed, which is, a lot of these medications out there. That's rather than that's
Well,
so interesting to me
and in
too.
their defense, it's not their fault. It's
Hmm.
what they're trained and educated to do.
Sure.
But from a 30,000 foot perspective, what are we doing? What are we teaching people? Because that's how my sleep apnea was treated, was by treating the symptoms. I mean, by giving me a
Well, and
machine.
that's why I've been such a big fan of things like, functional medicine and things like you're talking about. Cause it's like, well, why don't we fix the problem rather than treat the problem? Because that treatment could be causing other issues with the body we don't know about yet. Right.
Well, and surely it couldn't be because we have shareholders and we're making billions of dollars.
Don't even get me started there.
Surely it couldn't be that. Surely it couldn't be because we want to sell Ozempic.
Oh man.
We
Or
don't tell
that's,
people
what
to
is
maybe
that?
start fasting.
That terrible commercial. It's a diabetes drug commercial, Jar Dance or something like that. And the lady is like really heavy and dancing. And I'm like, how about we just talk about diet and exercise first? That would be good.
It's Jardiance, I believe.
Okay, there we go.
Yeah, and aren't the names hilarious? I mean, the names that they come up with, and we could do a whole podcast on deregulation of big pharma. I mean, they're going directly to their consumer, and they're saying, "Ask Dr. Jeremy about the fact that you might have restless leg syndrome." I mean,
Right.
And so, you're
Well, we can thank Donald Rumsfeld for that in the 80s, but anyway.
well, somehow somebody convinced the FCC that was okay, I guess, somewhere along the way.
Well, we can thank Reagan and Rumsfeld for that in the 80s. But anyway, I guess looking at it then is the thing that's really interesting to me is what you're talking about here is how you're actually embracing technology to handle a lot of these issues. And I'm curious, how is dentistry embracing technology more, and how is that enhancing patient outcomes?
Well, dentistry is embracing technology very slowly. Yeah. So, which is kind of I guess we're coming around as a profession, but
Sure.
in 2014, when we had started having FaceTime on a phone, I knew that Jeremy didn't want to go from Battery Park to the Upper East Side of Manhattan to see the endodontist for 15 minutes after he waited 2.5 hours to find out he needed antibiotic for 4 weeks and come back and have a root canal.
Mm-hmm.
So, I knew that telehealth was going to change everything. And so I started building an app called Smile Finder back in 2014. But I didn't know anything about capital raise or venture funding or angel investors. And so I didn't ask for enough money. If I'd asked for $30 million, you'd probably be on my podcast, right? But instead I asked for 500,000. I was going to test market it in Nashville and Phoenix. And I had some grand plans. But about that time, Smile Direct Club and Invisalign had merged with one another. Invisalign had purchased 23% of Smile Direct Club, and they were looking to build a doctor network in Nashville. And so I started speaking with them, and I've been helping them and doing consulting with them for 7 years now. And it's a particularly bad week for Smile Direct Club. They did file bankruptcy last Friday, but it's a restructuring, and fingers crossed that they'll be continuing to help folks who live 200 miles one way from an orthodontist. Give them the capability to still maybe have a simple orthodontic case. But dentistry, I say slowly, we've been slow to embrace telehealth, I would say in some respects, but our profession has been in many ways really advanced at embracing technology. When I graduated from dental school, was kind of the rotary endodontic root canal revolution. And you remember how people used to say, I'd rather have a root canal than do that. Well, because root canals used to be the thing in our life that would be the worst possible human torture anybody could ever endure.
Oh, and my wife's going through a whole she's been doing like this organic dental implant type thing now as well, because she had a root canal that the infection never went away. So she had the infection spread to her jaw. So I'm kind of iffy on root canals.
Yeah. Well, root canals, when they're, and of course there's a film I think on Netflix about root canals causing cancer and all kinds of other things. And that has not been, I've performed thousands of them. Sure. It's just like any medical treatment. If it's done properly, it works great. And so, if somebody told me that I needed a root canal, depending on the situation in the tooth, I would 80% have it done in 2023 and beyond. There's a group out there that kind of says, okay, well, why don't we just do an implant? Because implants have a 98% success rate since 1972. That's more successful than cholecystectomy. That's a really impressive stat. Think about that. Dental implants have a 98% success rate. So there's my plug for general dentistry and oral surgeons out there. Go, if you're a patient and you want to have an implant placed, what are you waiting on?
They're expensive as anything, I guess, is the only problem with them.
That's one reason you might want to wait. Yeah. But if you can afford it, you should have it done. To a patient, almost every single patient that we ever placed implants on, their first question to me at Hygiene 6 months later was, why did I wait so long to do this? I'm chewing so much better. I'm eating things I haven't eaten in years. I'm functioning better, so much better. But where were we, Jeremy? You asked me a specific question.
We were talking about technology and dentistry, and we've kind of been looking at these different applications of it, which I think it's interesting, because I think even if we can embrace it to make the patient's health better, I think it's good. But at the same time, dentistry is a very specific way of doing things too, so you don't want to alter things too much.
Yeah. So we were talking about technology and dentistry, but the year I graduated was right around the time that every general dentist started looking into making root canals easier for themselves and patients and their teams to perform for the patients. And and so that was just an example. And almost every month that I've been in dentistry since 1996, there's been some cool piece of technology that happened that made life better for me, for my patients. I mean, you take a look at intraoral cameras and how those things have, I mean, we're now taking, I've got a Medit scanner sitting over here in my office. It takes 6,000 images a second.
Wow.
I mean, so we generate digital impressions now. There's no goops that go in people's mouths anymore unless they just want to do it that way. So every month something happens that makes dentistry better. And telehealth is going to change that. You look at a company like my friend, Dr. Maria Kunstadter, and her company, the Teledentists. I mean, they're forging new ground as far as taking care of patients. There are 24 hours a day, 7 days a week. You can get online and be seen by a dentist with her company. If you have a dental emergency, they can prescribe you antibiotics. You can go to the 24-hour Walgreens. You can feel better until you get to the office the next day. They connect you with a patient. I mean, telehealth and AI is going to make things so much better for us. And that's what I'm working on now, is getting back to the theme here, which is sleep disordered breathing, sleep problems.
Right.
I'm developing doctor-directed AI technology, which most of the dental statutes in all of these states were written, in the 1870s when barbers were dentists, and people were slinging lead and tying their horse up in front of the saloon, that kind of thing. And so, I'm going to be helping, I'm sure, with some of these states help write AI dental statutes that need to be a part of, because with AI, I could literally treat 1,000 children an hour, because if I once we teach the AI, what we're looking for as far as signs and symptoms, because and hence my focus on the kids, is because I don't need a fancy x-ray. I don't need a $400 CBCT, $500, $600, $700 if you live on a coast, CBCT done on a child. It's nice to have, but I can tell by looking at someone's children across the airport terminal if they have, these kids have very significant signs of the issue. And because we're 4 generations into this now, it goes all the way back to these studies. There was a book done by an anthropologist named Dr. Robert Coracini, where he studied skulls. And when he looked back at skulls throughout history, these human skulls had all their wisdom teeth in. Their jaws were broad. Their smiles were wide. All their teeth were there. They had 32 teeth. They had all 4 wisdom teeth in. They didn't, And so what happened is, and the key is what you mentioned off air before we started, is breastfeeding. In sub-Saharan Africa, children are breastfed typically out of necessity and food insecurity and things like that. Children are breastfed until almost age 5. There's a very, very low incidence of sleep apnea in sub-Saharan Africa. And so, but here in the U.S., we've got both parents working. We've got mom got to go back to work. So maybe her maternity leave is a little shorter. So every baby leaves the hospital with what? They leave with a pacifier. They don't even leave the incubator without a pacifier.
Yeah, I don't. My babies were born at home, so I don't know what they leave the hospital with.
Well, good for you. So did you guys use?
My wife had both kids at home with no drugs and a midwife.
Impressive. Yeah. Good for you. Good for you guys. Look at all that research you've done and looked into that. And good for her on being able to do that and not requiring a C-section or something. Thank God. So anyway, but most children are given a pacifier when they're born. And when you start, one of my colleagues that I mentioned earlier, Ben Moralia, he does a presentation where he hands out a tray of pacifiers and asks every doctor and team member in the room to put it in their mouth, because it becomes an appliance. And when we start sucking on it, you start moving the baby molars together, and it instantly starts arching the palate. And there are some out there that are better than others. But,
and is it because that's just not a natural movement? Is that why, as compared to breastfeeding?
Yes. Breastfeeding, it turns out, is more of a chewing motion or a biting motion than it is a suckling motion.
Interesting.
And so and also part of it's soft diet too, because moms are going back to work over here in the Western Hemisphere faster, and sometimes, or maybe mom is not healthy and she's not able to produce enough breast milk for the child and they're not thriving. Then we start them on a soft diet, right? Soft foods from Gerber and strained peas or whatever, we start feeding the kids. And it turns out that our jaws are designed to gnaw on a carrot or gnaw on a bone that won't fit down their throat, where they can't choke. And that actually, helps the child in some of the communities we've found that don't have access to soft baby food.
Mm. Very cool. Well, Dr. Leeds, I've really enjoyed this conversation. I feel like I could talk to you for about hours about this stuff. I'm so enthralled. So for people listening, you have a book coming out, which is called "What Happens When Our Children Don't Sleep." So where can they find that, and where can they find out more about you, sir?
Sure. Well, they can come to, we've got a website set up called sweetdreamsmiles.com, and it should be up later this afternoon. We're taping this in Central Time on October the 4th in the morning. So I'd give it till later today and tomorrow, but the site will be up, sweetdreamsmiles.com, and there'll just be some information there. We'll give you a little book summary, just a free gift for listen to the podcast, or you can check out what we're doing at askdrleeds.com. That's my website where I coach other doctors about this and also treat patients. And you can keep up with us and what we got going on and pre-order the book if you want to. It comes out probably in December or January.
Very cool. Well, Dr. Blaine Leeds, thank you so much for hanging out with me today, sir.
Thank you, Jeremy. Appreciate it.